So it's a very, very good day. New York City's first and only Ebola case successfully treated. Dr. Spencer is Ebola-free, and New York City is Ebola-free. And Dr. Spencer deserves our gratitude for what he chose to do to serve others, to help his fellow human being in the nation of Guinea, but also to protect people all around the world, to protect people here at home by addressing the root cause.
Hello. My name is Craig Spencer. I am a physician and aid worker for Doctors Without Borders, also known as MSF. I am very proud to be among the ranks of more than 3,500 providers working with Doctors Without Borders to respond to the Ebola outbreak in West Africa. Since I was admitted on October 23rd, I've received an exceptional level of medical treatment, support, and encouragement from the whole medical and administrative team. Today I am healthy and no longer infectious. My early detection, reporting, and now recovery from Ebola speaks to the effectiveness of the protocols that are in place for health staff returning from West Africa. I am a living example of how those protocols work and of how early detection is critical to both surviving Ebola and ensuring that it is not transmitted to others. While my case has garnered international attention, it is important to remember that my infection represents but a fraction of the more than 13,000 reported cases to date in West Africa. The center of the outbreak, where families are being torn apart and communities are destroyed. Within a week of my diagnosis, many of these same patients called my personal cell phone from Guinea to wish me well and ask if there was any way that they could contribute to my care. Most incredibly, I watched my Guinean colleagues who have been on the front line since day one and have seen their friends and family members die as they continue to fight to save the communities, their communities, with so much compassion and dignity. They are the true heroes that we are not talking about. Please join me in turning our attention back to West Africa and ensuring that medical volunteers and other aid workers do not face stigma and threats upon their return home. Volunteers need to be supported to help fight this outbreak at its source.